You can see why we're making such good progress around the country in terms of educating people about this disease and trying to save lives. We have some heavyweights and we have some warriors. And I just want to give a shout out to Charlie Hill because you mentioned his use of the term warrior. And Charlie is always with us, but Charlie had a medical procedure this week and was not able to be with us. So Charlie, we're shouting out to you and wishing you well, and you are in our prayers. I wanted to break in here, Artie. Do you mind if I take a minute? Okay.
You're the boss.
I spoke this morning at our opening about the great support that we received when we started the summit from Senator John Kerry and Congressman Gregory Meeks. Since Senator Kerry has moved on to other pastures, we have gotten the same level of support from Senator Elizabeth Warren out of Massachusetts, who replaced Senator Kerry. And it is through the support of Senator Warren that we are able to be here today in the Kennedy Caucus Room, and this is a great room. So we really appreciate that. Senator Warren and the other two senators, by the way, are not in D.C. this week because the Congress is not in session. But we do have a statement from Senator Warren from a member of her staff, Ms. Brim. So would you please come forward?
Thank you so much, everyone. And again, I apologize once for my voice, but also on behalf of Senator Warren for her not being able to be here today. Congratulations on 10 fantastic years. Our office is very, very pleased to continue to work with the Prostate Health Education Network and really commends the great work you're doing. Even though prostate cancer is the second leading cause of death among men in America, the more troubling statistic is the enormous health disparities that exist. It's clear that we really do have a lot of work to do to raise awareness about the disease, to encourage men to get regular cancer screenings, and to find better treatments and a cure. Senator Warren is committed to continuing to fight for funding for the National Institutes of Health and the National Cancer Institute so that researchers are able to gain better insights into the causes of prostate cancer, including the very clear disparities that exist in men facing this disease. She also supports efforts to increase screening and awareness in minority and traditionally underserved communities, as well as supports important work of community health centers. Thank you again for all of the important work you're doing and for coming together here in Washington, D.C. for the summit. We are proud to support you and look forward to continuing to support you and working with you in the future. Thank you.
Thank you so much. And please thank Senator Warren for us.
Thank you.
I am going to turn the program back over to Dr. Shelton. And because I know there may be some questions, but you know, I just want to say this about young men and prostate cancer. I have noted, as I look back over the men who are joining our Survivor Network, that over the last 2 or 3 years, at least 50% of those men are less than 50 years old. And so when I saw this study, the report about Dr. Cooney, and knowing our statistics, I was able to reach out to her, and I'm so glad that she was able to join us today because we really need to do a lot of work in this area.